Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Here in a few short minutes, I'll no longer be the president of the council, and I'm good with that. I hope everybody else is celebrating as much as I am. There you go.
No, I'm just kidding.
So I call this meeting to order. And it said my next official business is to call for the minutes to be approved. So I hope everybody's had a chance to read them. And if there's any corrections, we would like to know about them. I did not see any. But if someone did, please speak up. If not, I'll entertain a motion to accept last month's minutes.
Motion to approve is written.
Okay, I need a second.
I'll second it.
And all in favor, signify by saying aye.
Aye.
And opposed, carries. Now, Mike Pittman thinks he's next, but he's got to wait just a second because I want to get rid of this position and title. I'm hearing that there's assassination attempts possible. I want to get rid of it, so I'll entertain a motion for a president to replace the soon-to-be past president. So may we have a nominations, but we can have multiple nominations. Doesn't have to be just one.
Nominate Heather.
Okay.
I second
And
that.
can we have a second on
I
that?
second.
Okay. Are there other
Elmer
nominations?
Fudd.
Huh?
Elmer Fudd.
Elmer Fudd.
No, I'm just kidding.
Okay. So if there's no other. Any discussion? All right, I'm happy. All those in favor of Heather Floyd being our new board or our new council president, signify by saying aye.
Aye.
And I think that motion just carried.
Got speaking for her.
I am no longer the president. You may call for nominations for a vice president, please.
Are you giving me my how-to book?
I have a gavel right there and I just passed
I
it.
can yell, you know, both have coaches' voices, we can yell out if needed. Okay, so I think my first order of business would be to call for nominations for vice chair or vice president of the council. Does anyone want to make a nomination?
Nominate Chris.
Ray Denny nominated Chris Shelton. Do we have a second for that nomination? I don't know if I'm allowed to make a second. I'm not positive, sure, probably not. Yeah, I would.
I'd like to nominate Gary Copeland, please, as well.
Okay, so we've got Chris Shelton and Gary Copeland for vice president. Any other nominations from the table? Okay, probably the easiest thing to do then would be to call for a second for either of those two nominations and then we'll vote.
I'll second Chris's nomination. I'll second Gary's. Mercy rule.
Now, who seconded what?
Gary
Oh, Gary?
Copeland seconded the nomination for Chris and
Okay.
Dwayne seconded the nomination for Gary Copeland.
Okay.
So, obviously there would be six, parties at the table voting. So let's just go by a show of hands or all in favor for Chris Shelton for vice president. Voting 1, 2, 3, okay, and for Gary Copeland, 1, 2. Are you abstaining or are you voting? You
Well,
technically made the nomination for the second for Chris.
yeah, okay, I'll vote for her. I mean, I can abstain, I'll abstain for me. How about that?
Okay, so if we have an abstention, then 3-2, so I know that's always a little awkward, but Chris Shelton then would be our vice chair
There
for
we go.
this calendar year 2024. Okay. Okay, thank you. So now, Mike Pittman, you are next on the agenda.
I don't have to be nominated, I think.
I don't think so. You won.
What, yeah?
I think that was a compliment, Gary.
Okay.
Yeah, absolutely. Hi, Heather and I worked out a transfer in my budget for Josh Klein to increase his salary, and I think Heather, you got those numbers.
Yes, the transfer was $10,010 from 1,000, which is county general. So basically from the part-time ordinance enforcement, that had been budgeted at 25,000 for the last couple of years, and that had not been used. So we're transferring that $10,010 to building inspector,
Which is the
which would be,
11140.00000.0314.
yes,
Okay.
so 314 is building and zoning, and then plan commission is 007. So it's out of different budgets, but it's all within county.
Any questions for Mike? No, we've spoken already about this and
Yeah,
the desire to keep him in that position.
keep him in that position. I think we'll see the offset within the first 3 months of the year. We've got some cases. I'm hoping we can get through the legal system. Unfortunately, the legal system's been throwing something few. We're working our way through it. So we're learning and they're learning. So I mean, the unsafe building code is a great code, but it does take some time, which it should, because you don't want to walk on somebody's property and do something without legal authority and giving them an opportunity to do what they need to do.
Right.
So, but I'm very impressed with how Josh is handling this. He's taking a lot on his shoulders to do this, as I've told you, and I think we'll make up the increase in no time on that.
So we would, actually, this is not technically listed as a part of our overall ending transfers, is it? We can go ahead and vote on this now.
You can go ahead and vote on
Let's
it.
go ahead
And
and do that.
then, yeah.
Okay, so we would need an entertainment, motion, for the transfer of the $10,010 from part-time ordinance enforcement to building and zoning inspector.
I'll motion to approve that.
I'll second it.
And Gary, second. All those in favor, say aye.
Aye.
Okay, those opposed? Okay.
Thank you.
I didn't think we had any additional questions. We appreciate you being here.
Yes, thanks.
I'm off to the plan commission and BZA. Thank you. I appreciate it. Thanks for being patient with
In
me.
meeting tonight. Thank you,
Thank you,
Mike.
Heather, for your
Thanks,
help.
Mike.
Not a problem.
And Megan, we have you next on the agenda regarding the treasurer investment resolution.
The one I presented at the last meeting, I think it just needed another reading.
Because it was an ordinance, we had to read it a second time.
And that is ordinance number 1. Yeah, it's 2024 1. Could have given you a print copy. Did you read it? We do need to read this out loud, am I correct?
You want it?
You don't have to,
I
but
have a printed
you
copy.
probably are really used to the verbiage. Heather, it's totally up to you. One of us can read it if you, I'm happy to.
I can start. It's just.
It's,
one.
I was gonna say, it's a one pager.
An ordinance to adopt an investment policy authorizing the investment of public funds of Jefferson County and to authorize the Jefferson County Treasurer to make investments having a slated final maturity date of 1, more than 2 years, but 2, not more than 5 years after the date of purchase or entry into a repurchase agreement, whereas Indiana Code Section 5-13-9-1 grants authority to the Jefferson County Treasurer to invest public funds. And whereas Indiana Code Section 5-13-7 establishes the Jefferson County Board of Finance pursuant to Indiana Code Section 5-13-7-7, the Jefferson County Board of Finance must annually review the overall investment policy for the county, and whereas pursuant to Indiana Code 5-13-9-5.7, A, the County Council of Jefferson County may adopt an investment policy, authorize investment of public funds of the political subdivision for more than 2 years and not more than 5 years. Now therefore it be ordained, the county council pursuant to Indiana Code 5-13-9-5.7 A hereby adopts the Jefferson County Investment Policy, which is attached to this ordinance in Exhibit A. The county council pursuant to Indiana Code 5-13-9-5.7 C hereby authorizes the county treasurer as investing officer of Jefferson County to make investment having a slated final maturity date is one, more than 2 years, but two, not more than 5 years, after the date of purchase or entry into a repurchase agreement. Should any provision, section, paragraph, sentence, clause of any portion of this ordinance be declared by court of competent jurisdiction to be invalid for any reason, the remaining provision or provisions shall not be affected if and only if such remaining provisions can, without invalid provision or provisions, be given the effect intended by the council in adopting this resolution. To this end, the provisions of the ordinance are servable. This ordinance shall be in effect from and after its passage by council and in compliance with Indiana Code Section 36-3-4-14.
That's our second reading, so we technically can.
You
go ahead
can
and
vote to
on
forego the third reading, and then you can vote on afterwards.
Let's go ahead and take care of that tonight.
I make motion to forego.
Okay.
That's what I was gonna
Forego.
do. I'll
Everybody
second that.
Okay, so all those in favor to forego the third reading? Aye. And any questions from Megan before we entertain a motion to adopt ordinance number 1? Would it be prudent, Megan, to, obviously for what was just read, a long legal document, maybe to give a quick statement for listeners and or media in layman's terms for, those listening, what this means, the Cliff Note version?
I believe it's just an extra line written in for longer term investments.
Sorry, many questions, but
Okay.
no more than 5 years.
Right, so I think German American had a 30-month CD or something that they proposed, which is why we kind of thought about that, because the 2-year was below, or maybe
I don't recall 30 months.
a 30-month, I don't know why
Pat
that's
just-
sticking out in my
Pat was
mind.
the one that recommended it. He did the research
Okay,
on it
I
and
did.
said this is what usually goes hand in hand with an investment policy that was already approved. So I just wanted to do my due diligence and make everything.
So we don't have anything in mind. This just gives you the ability to do that if you do say, okay.
For the future.
And written up by our legal counsel.
Yes.
All
I'll
right,
make a motion to accept this ordinance number 2024-001.
I'll second it.
second by Gary. All those in favor? Absolutely. Those opposed? Okay. Megan, thank you for being here.
Appreciate your time.
And Lindsay from the health department, we've got you next on the agenda. I know we got all sorts of attachments.
I did
For
not print all those out.
Lindsay, I didn't print all of them either.
That's that.
I did not control either this time. It was a lot.
That is just, we don't have.
Was that from last month? That may have been.
No, it's, the first resolution.
It's the first one. It probably still has Ray's name on it.
It does.
I'll just strike it out underneath and then sign it.
Okay.
Yeah,
Okay.
or principal, president.
I don't know. This role's hard enough. I would not be a school principal.
You're the principal.
Okay, Lindsay?
All right, so I apologize, I'm a little under the weather, but, wanted to be.
I know, everybody is.
Right, like everyone does. I also just kind of wanted to give you guys a little bit of update. It's, we're up with the last quarter and, we haven't really done updates before, but I thought maybe you guys would enjoy
Appreciate it, yeah.
the numbers.
So they're not in any particular order, but we do quarterly reports and annual reports for the board. So I had my team get our quarterly reports done. So they're kind of by subject matter more than anything else. So we had 14 animal bites that were reported to us. We had 49 septic consultations, 37 field inspections for septic systems, 8 septic permits, and we assisted IDOH and IDEM personnel on 20 different job site attendance. We've done 95 retail food service inspections. And we've we've sent out 18 temporary permits, each of those involve an inspection. We have 2 new restaurants in town. We've administered just over 1,500 immunizations for the last quarter, which is about 42 a day for what we Tuesday, Wednesday, Thursday are the days that we give immunizations. So per day, that's about 42. We've done approximately 50 TB tests. We've held a drug and syringe drop off in coordination with the Sheriff's Department, the Madison Police Department, and Healthy Communities Initiative. We had some Hanover College students come out too. They were working on a school project, and we collected 45.5 pounds of medicine that was sent with the Sheriff's Department, and we collected 37.5 pounds of sharps, needles and stuff. So everything was properly disposed of. We had some educational materials as well to give out. And those numbers are actually down from the one we had this spring. So we'll be having another one this spring. And we did have one more person become a certified child passenger safety technician, which is they go through 3 days worth of training. And it's usually not around here, so they're away from their family for 3 days. They have a training day, like a learning day, they have a hands-on day, and then they have a day where they're servicing the public, where they're actually putting these car seats in, they're being evaluated. So they're following all the rules, procedures, codes. I don't know if you guys know this, but to put a car seat in, most places are not going to just do it. You have to go to certain places to have a car seat put in because of the liabilities and stuff. So having a trained technician is key. We have 3 of them. And we've issued 379 birth certificates and 627 death certificates. And as well as doing 33 paternity affidavits. So that's to completion. There's several that were open, but that's.
Was that in the last quarter, you said?
Mhm. And then on top of that, these statistics are kind of new. I've asked them to keep track of some different stuff than what they've ever had to keep track of. So I think we're lacking a little bit in these, but we attended 103 meetings, just the department alone, and 13 trainings in the last quarter. A lot of these trainings are things that are required either by grants or for their certifications that they already have, or this new HFI funding that we have now. It has been deposited. So just giving you guys an update with that one, and we'll get into that.
Speaking of meetings, I heard you did a great job today. I wish I could have been there. I had come back from the meeting. Lindsay
thank you.
spoke to actual substance abuse council meeting through HCI and gave an update on the health. Did a great job presenting at that meeting.
It's always a chore to try to scrunch up 2 years worth of, almost 2 years worth of learning into 45 minutes. So thank you. That was good feedback. Nice to hear. All right. So I didn't put these in the same order you have them, so I'll pause. But I grouped them together more efficiently. They were just alphabetical with how I sent them. So the first one is the Childhood Injury Prevention Coordinator. We currently have a grant that gets us car seats per year, but it's kind of we request them, then we wait to see how many we actually get. So we don't have a lot of control over that situation. This new Health First funding is going to allow us to be more present with car seats. This is a trauma and injury prevention, which is one of the core public health services for the state that we're required to rise to the occasion on. So the purpose of this position is we now have three coordinators, not coordinators, we now have three of the car seat technicians. So this person would supervise them, track all of our inventory, track our demands, try to make sure that we don't have the waiting list that we've been having here recently. It's just an increase in workload for this person, but like I said, when I was here before, I just don't feel like all of these together, one, they're not necessarily cohesive, but two, I just don't think it justifies another person, but I will say that my team, there are very few people that don't have a full schedule. Do I think they can add this in? Yes, but I think it's a lot to add. When you start adding stuff to people's job on a regular basis, it's just, it's slightly demoralizing to add too much to somebody, so I just want to make sure that we're compensating them fairly for the additional jobs that the state's wanting us to do. So I put $2,000 on here. My thought process is that as this program grows, this might grow as well. Like they want us to look into helmets and other trauma and injury prevention. And I don't want to bite off more than we can chew to start with. I want to start at a manageable, reasonable level. The second one is a certified environmental assessor. We are going to be required to go do in-person pool inspections for this new Health First funding. So currently we get the information from pool samples and we get the data sent to us. We don't have to go in person and test these pools and look at their surroundings and make sure that they're following the rules. But now we have to go in person. We're also going to have to do a lot more environmental follow-ups, and we're going to have to do our own lead assessments. So Medicaid is requiring children of a certain age to be tested for lead on a regular basis. If they test within a certain range that they've actually lowered within the last year, then it has to have an environmental assessment as well as some other follow-ups like clinical side. So before we used to be able to rely on the state, now we have to have someone that we use ourselves. We can't call the state and have them do an environmental assessment. We don't really know how this is going to develop. We don't have a lot of lead cases that actually meet the requirements as of right now. So I didn't want to go too high with this. We don't have a lot of public and semi-public pools, and we don't know what the environmental complaints are going to be. But I do know that we are going to have to go do pools on a regular basis, and we are going to have to start doing going to certain buildings for particular complaints. So I want to make sure that we have it covered. We're adding something to this person's schedule that didn't normally have to. So this might have room to grow, but I wanted to understate it to start with. See what it gives us. Infectious disease case manager. STI prevention and detection is part of the core public service. There are requirements depending on which reportable disease it is, depending on how quickly it has to be reported to the state and how quickly tracing and some other things have to be done. Some of them have to be done within 24 hours. They don't care if it's Friday at 9 p.m. When it gets reported, we have to do something about it by Saturday at 9 p.m. So this person would be 24-hour on call for this particular sort of engagement. I think last that's fine. Last quarter, I can't give you specifics because of the low numbers, but we had we did have enough positive cases and 2 of them were a 24-hour reportable. So this is something that this person is gonna have to be doing on a regular basis. So that covers that one. The fatality review coordinator. This is new. This is part of, this is listed specifically, fatality review teams is its own category for the new Corps of Public Services. So they're requiring that we have fatality review teams for child fatality, fetal infant fatality, and overdose and suicide. So currently Jefferson County does it, all of those, they do participate, but not the health department. And I don't know that we actually have an active representation. We just go over our data and it's like a tri-county effect to it. The health department, IDOH is now requiring the health departments, either be a part of or facilitate, create these fatality review teams. So this is gonna be starting from nothing, working with IDOH because they have certain people that they want on these fatality review teams. We can't just pick a group of people and nominate them. They want certain professions, they want certain elected officials, they want certain people on these boards so that they make an impact. One of the things that these review teams do is, well, actually, the thing that they do is they go over the data, not just from what the health department has and the breakdowns and some of the background information that doesn't always make it onto these certificates. But they also reach out to family and friends, and they contract and coordinate with social workers, because it's probably best that it comes from them when you're reaching out to family and getting information about these people and their personal lives. You're asking about their school from small age all the way up until wherever they landed, whether that's a doctorate or below. And you're looking at their grades and their behaviors in school when they were there. You're looking at police records, and some of this stuff is highly confidential. Medical stuff is allowed to be given to the health department, which is why they really want it ran for a member of the health department on it. It's ideal that they're running it. Because of that confidentiality, and the need for that information gives you so much more information and detail about this person's life. And the goal is that at the end of it, for like, let's say the suicide or overdose fatality review team, at the end of it, they're hoping to walk away with an action item. Like, one that I went to was, while they did all these other campaigns and they had been active in all these other things, and this person was trying, at the end of the day, they used again, and they went back and they were using alone. So their campaign was timed. It wasn't anything earth shattering or earth moving. It was, don't use alone. So they walked away with this campaign to at least hoping that next time it could help the next person. So the goal of these are to walk away with action items. So the coordinator would be the person that's getting all this information from all these other people, bringing the agencies together and facilitating this meeting. Now, the next one is the fatality review analyst. This is somebody that's going to get the data from our end, interpret it, put it in terms and things that people can understand. Take minutes and follow all the reporting, because all this has to get reported to IDOH. When you're looking at all this information, like right now, we have to send all of this information every quarter. I think it gets sent to like 8 different agencies. At the end of every month, it gets sent to all these agencies, and at the end of every quarter, it gets sent, but then also a quarterly report gets sent to all these different agencies. I think even the auditor's office, you get something. I'm not sure what it is, but death certificates, I think.
Yeah, so we received that so that we can We received one from the state and then from the county.
So we would modify this data and see what we needed to actually bring to the table for these fatality review teams. And they would be available for analysis. And then the compliance coordinator. There's been a lot of updates that's needed to happen and that still need to happen, and we need somebody to be in charge of it. Since the title in itself kind of implies some sort of level of security, I don't really want to go into too much detail as to exactly what we need this person to do, but on this, it's pretty public, just the HIPAA and some coordinates, like, what is this, coordinates and maintains on-site AEDs, the BLS CPR AED certification for individuals. And then there's also some just like electronic clearance monitoring and some data, just some data stuff that really needs to be paid attention to a little bit closer. And then the last two are different emergency preparedness. So these two will actually get paid for out of the emergency preparedness grant. Instead of having a large portion of someone's salary being paid by this grant, we would transfer that into these two stipends and use the remainder to help with emergency preparedness in the community. So we would be able to partner with EMA a little bit more. And we would also probably be, as long as it fits into certain criteria, I'm still kind of in debates with the supervisor for, the regional supervisor for this grant about what it would cover, but I'm hoping things like Stop the Bleed and AED and stuff like that for community, like our county employees would be a great start. Anyway, so we'd have a lead on this, and the grant required us that we have a second, so we would still have a second, and it would still be Blythe. And I think the positioning of this, if and when eventually this funding will go away, ideally will become incredibly healthy, and we won't have this funding anymore. So theoretically, that could go away and it could revert back to funding the remaining portion of Blythe's salary that's going to be paid out of the Health First for a while. So she can, since we're expanding with our nurses, I kind of want her to be more of a nursing director with a little bit of attention on emergency preparedness versus right now it's split 50-50. So I think this is a win-win scenario. These last two are best use of our funds. Did you guys have any specific questions about any specific one of these?
That's so good. I am curious, because obviously when I first saw them, one would assume, of course, that this would be additional salary dollars for existing staff. Probably not gonna find a stipend positions, hire somebody for $1,000 to do this,
No.
$2,000 to do this. It's not, I don't think that any of us are opposed to that. Just curious, in coordinating with a regional supervisor who's assisting you and you're directly for questions for the Health First funding. Are you seeing some other counties do similar? You know, we're gonna add some workload to you, and we're gonna use part of these dollars to supplement salary. Are you seeing that across the state?
So some people are doing stipends, some people are actually doing a separate ordinance, so they have their ordinance that is no matter if Health First is here or not, like this is what you're gonna get paid. But then if Health First is here, you will also get this amount every year as well. So they're doing two separate salary ordinances. We've seen what they call just like market adjustments where they did a blanket raise across the top. But I think a lot of counties are hesitant to do that. So we've seen a lot of these stipends to just acknowledge that we're asking them to do more. And I did, in crafting these, I also did try to make sure that I was maintaining a certain balance with kind of how the salaries were already laid out in terms of who made what. And in terms of, it wasn't my defining factor, but it was also, so it's kind of a proportion of the amount of work that I'm adding as well as what their salary already was to begin with, so.
And a little different than traditional grant funding, which might pay for a new full-time staff member. Obviously, this is a little, I think, a little different.
Yeah.
Unique. But I was just curious if you, have confidence and or not necessarily approval, but if we're seeing other counties move
Like if this is
similar
gonna be
direction.
accepted.
Right,
Yeah,
and if
it'll
even you're
it'll definitely
directly,
be accepted. This has been something that's been talked about, like different ways, creative ways to kind of come up with and get people some additional money, but also, you know, the workload really truly is increasing. These are all new stipulations on these people's jobs that they've had for a long time. And while some of them have seen changes off and on, especially during COVID, you know, the nurses saw a lot of changes in their job structures, but the things are not the same as they have been. They are putting more workload, and like I said before, I couldn't justify the idea of bringing more people in. It just doesn't, like, it made sense for the public health educator, and it made sense for the part-time food specialist, but it did not make sense for some of these other things. But at the same time, acknowledging that I am asking them to do more. We're asking them to do more by signing up and agreeing to do this health first funding.
I think I would want public and county employees to know that we're obviously, the goal is not to be creative, just to try and boost salaries.
No,
Obviously, this
This is-
council has the desire every year to try and add sometimes
Mhm.
percent raise, to do what we can. Yeah, when you mentioned cost of living but yeah, this is obviously
yes, these are all directly related
additional work that's being asked.
for public services that are new jobs.
And any headway on the previously, the open positions, new positions that were filled with health, there's any, progress on hiring for those positions?
We have a couple candidates for a few of them, but I still need some more qualified nursing candidates.
Did you have
the
a
salary is
placement
a
and the
huge-
health educator and the part-time food
The
specialist?
salary is a huge thing. I mean, it just is. With these nursing contracts now, I mean, I know that their hours are crazy for a while, but then they can take months off at a time and they're making twice as. You know, I'm asking them to leave that for half of what they could make somewhere else. And it's kind of, I think it's just
You're
gonna
just
be an
trying to
uphill
find-
battle.
Right person.
And the hope is obviously a little different than somebody that's working 12s or having to work holidays or working.
It
thirds
is,
or
and
working
the
on
hope is to
weekends.
find
So
something
hopefully
that,
this is-
somebody that isn't wanting that, that's the one thing that 9 to 5 with some different flexibility. But when you look at the number, it's just, I mean, we have one of our nurses now, when they left their job to come to the health department, the proportion of difference between what they had and what they dropped down to is very different than where it is right now. So for nurses, it's kind of a hard sell. So I think we're gonna have to push and maybe be a little bit more creative. But I was hoping to not have to pay to advertise. I just don't feel like that's a good use of county money or taxpayer dollars, or rather, even if it's from Health First, so it's still taxpayer dollars. And I just don't know that that's a good use of the funding, but if I can't fill the position, then I'm gonna have to.
How many, I'm gonna ask a question about this fatality review coordinator. How many hours, you're not doing it currently, correct?
No,
I just, how many hours do you anticipate them having to contribute to this? Because we have, that could really add on quite a few hours. Are they gonna coordinate with the coroner?
I was gonna say, and or is it gonna be a support in the fact that obviously could potentially take off a little work for the coroner?
it's not gonna, I don't think it'll take off any work for the coroner. It's more of an analysis of, this is where their life was, this is how it headed, this is the trajectory, this is where it ended. And what could have been done in the meantime, to maybe help or prevent these, fatalities. So, it does take a considerable amount of time. Usually the review team, in other counties, I've been able to go to them. They do about 2-hour block and they do about 1 an hour. So they don't get every single person, and usually it's a case that's, something that's happened at least a year ago or more, just to make sure that it's, nothing's pending and they're not gonna talk about anything that's an open investigation or anything along those lines. So, I honestly don't know how much time this is gonna take, but I do know that it's, gonna be a salaried. So I don't know that it's gonna affect that as much. Time-wise, I don't think it's gonna translate into creating any additionals or overtime or stuff like that for the person. So,
Any other questions for Lindsay regarding these new small stipend positions for additional supplemented work? All right, so I'll be honest, I'm not positive sure. Is a motion actually needed for us to approve the additional? I mean, we're not approving the job description itself, but
So I'll need to include it on the salary ordinance the next time. So if you guys go ahead and approve salary wise for me to do that, and then on that report.
I think we advertised the money, but we didn't advertise as a.
the specificity.
We didn't,
We
so we can
over-advertised.
go ahead and do the transfer, we just can't, or appropriation. It's part of the advertisement, that'll be on the resolution.
Okay,
But it wasn't part of the salary.
Right, and then I advertised the full amount of the Health First budget. So
true.
that amount would also need to be approved once we get to that point. But I think a motion approving the stipends would be appropriate, and then I will include it on the salary ordinance next time.
Okay. So let's go ahead, really, we could go ahead while Lindsay's here and do, if we entertain a motion for the, approval of the new salaries additionals. That will get added to the ordinance, and then we could go ahead and do, the request for approval for the 1161, the Health First total, that's actually, or is that separated from? $334,000.
And then a portion of it is in health maintenance as well. The 25,000 in health maintenance, what was, I advertised that as well.
The 25, I think, was for these, just in case they were over, but I think total, it was like 15 and 15 and a half, and 6 of that is actually out of.
So then we
so
wouldn't
it's less than
necessarily have to
10,000.
approve the 25.
Yeah.
I was gonna say, I didn't see, and I don't think I remember seeing any other additional information on the 25,000 from the health maintenance. I don't know if anybody else.
Right, I think
So,
we budgeted, we went ahead and requested it just in case if there wasn't enough in the other, but it's enough.
but that really should not even be a necessity then.
Right.
Okay. So I guess,
We don't need to do that then.
yeah, let's go ahead. We can do just the Health First line item, but at first, let's go ahead and wrap up. Would anybody be interested in making a motion for approval of the new job descriptions that have been listed and outlined this evening? I assume we don't need to do each of those individually.
Mhm.
For the job descriptions or the salary?
But for the job, well, for the, I guess I apologize for the, salaries, yeah, that salary addition for each job description. I assume we don't need to do those each individually.
Because you're combined.
Right. Yes.
I'll make a motion to approve.
Okay, do we have a second?
Second.
And that would be for the infectious disease, the fatality review coordinator, the lead emergency preparedness, the fatality review analyst, the emergency preparedness support coordinator, the compliance coordinator, the childhood injury prevention coordinator, that was the first one discussed, and then the certified environmental assessor. I believe I got those all included. So Ray made the motion, Chris second. All those in favor of approving the pay increase with those additional positions? Say aye. Right. Those opposed? Right. Okay, that motion carries. And, let's go ahead while Lindsay's here then. The Indian Health First budget total, from 1161 would be the $334,861 that we need to approve this evening that has already been submitted. So we're going to entertain a motion for approval of the Indiana Health First budget.
I'll make a motion to approve that.
Dwayne, a second.
Second.
Ray, Tending, all those in favor? Aye. And those opposed? Black. Okay, that motion carries. So Lindsay, is there anything else you had for us this evening?
Was it?
Okay. Any other questions for Lindsay? No. All right, thank you, Lindsay.
Thank you.
Heather, I think we've got some updates from you regarding trash cards, and I know we need to approve our meeting guidelines for 2024.
Yes, so I'll go ahead and start with trash cards. So at the end of today, we have sold $63,000 worth of trash cards. Our total for the year last year was like 85, so we're well on our way to meet that goal. But we have already exceeded where we were of January of last year. So we are doing good. I think the trash truck drivers are doing really good of questioning people. We're getting a lot of people coming in, so.
Let's keep on our mind during budget time about changing those a little bit.
Yeah, it seems to be working fairly well. I think as a whole, I think they're going to try to crack down more on, what people are putting in, checking the cards, doing, more of a random once a month type checking to, it's a wonderful service. We just need to keep it funded so that everyone will have that available to them, so.
Obviously, those paying for it are quite appreciative.
So-
Those are made.
The majority of people actually, whenever I'm selling out at the site, they say, will they at least check? I want to show that I have purchased this card and I want to know that my neighbor's purchasing their card. And I said, absolutely, that's the goal, is to getting those checks in place. So, I guess the next thing I have is the meeting, guidelines, which it is the exact same as, last year, meetings will start at 5 p.m. unless otherwise advertised. Meetings will be recorded on an OWL multi-directional camera. Meetings will be published on Jefferson County, Indiana's, YouTube channel. Public comment will be limited to the end of the meeting. Any member of the public that wishes to speak must use the podium and clearly give their name and address. Public comment will be limited to 3 minutes unless council president grants additional time. To be added to the agenda, please notify the auditor at least 24 hours before the meeting. So if we could just have a motion for that.
I'll make that motion.
I'll second
Motion and a second to approve the 2024 council meeting guidelines. All those in favor? Aye. Those opposed? Okay. Thank you.
Okay, the next thing is temporary loans. So, we have had a county general temporary loan for multiple years. Last year was the first year that, we had to do a temporary loan for the reassessment fund. Both funds are in better shape than what they were prior, so I'm actually recommending that we lower the loans slightly. So for county general, last year we did $1,250,000 loan, and I'm recommending $1,100,000. And last year we did a $75,000 loan to reassessment, and I'm recommending that we do a $70,000. Both will come from Coon Courthouse. And, it just keeps these funds in the black until settlement time.
Additionally, Chair, I was gonna say, motion to approve both, I guess it would be loan one and loan two, resolution. I think those are
One and
two
two.
separate resolutions, yeah, one and two for the 70,000 and for the $1,100,000, thank you.
I'll make that motion.
I'll second.
We have to approve this separately.
I don't think I
Motion.
have to, if the motion just states
Okay.
approving both resolutions.
Okay, so approval of both resolutions, a motion from Ray Denning and a second from Dwayne, all those in favor for a resolution for both loans? Aye. Unanimous. All right.
Okay, and then, we've already approved Lindsay's additional. There was one other additional, which is also health department related. During budget time, this was probably my misunderstanding, to receive the Indiana Health First funding, we had to leave our, what I thought they said was budget the same as, or increase that. And actually, it was the funding from taxes had to remain the same and not the actual final budget number. So, I had to do a matching letter at that point. I reached out to, the state health and kind of told them our situation, that the funding was slightly lighter than what it had been in the past. And, they just said that we had to dedicate money in another tax fund to distribute to that fund during health department or during settlement. And then I will be able to correct that in budgeting next year.
Okay.
So I'm requesting an additional for 119,000, which is actually a little higher than what I anticipate we will need. But I went ahead and requested that higher amount just in case if our tax collections are down and our settlement actually ends up being less than what I'm budgeting for.
Okay, so technically, the resolution 4 included, the 334,861 that was just approved from the 1161 Health First. We are not voting on the 1168.25,000 from health maintenance. That's going to actually be scratched. So this would be the 119,000 from the 1112 lit funding, as just described by Heather, the dedicated amount, to help balance the health first fund. I probably didn't say that correctly.
So the state is requiring that our 1159 local health department fund remains funded at the same amount. In addition, we get the 1161 health funding from the state.
Okay. So we actually just need a motion for the 119,000 designated to lit as just described.
I'll motion to, designate that to lit for the 1112, 119,000.
Do we have a second?
Second.
Right, with all those in favor? Unanimous, okay. All right, Heather, anything else from you?
And now we have to do the resolution for, the two additionals. So we will be scratching the 1168 and the $25,000 figure. So our total approved amount on resolution 24 is the 24,400. Was $453,861.
That's the combination
Okay,
of
what is it, 161?
$453,861.
A combination of the helpers and the, lit the 119 that just was voted on.
A motion to approve resolution 2024-4 for $453,861.
Second.
All those in favor?
I have one last thing.
Carries.
I sent out a new copy of the salary ordinance, and Ray actually has that to pass around.
Is
I
it
have
updated?
went ahead and made
From this week.
some updates to that. I'll have to be back next month to add the stipends, but the biggest update you'll notice is that under guidance with our handbook revisions that we are doing, we have included exempt and non-exempt status on every position. So that it is very clear if you are eligible for any type of overtime compensation. So we just need to approve that, and I believe I went ahead and included in that copy the building inspector increase.
Okay, that we just voted on this evening.
Yeah.
And in your opinion, Heather, you potentially email coming from commissioners and or possibly even Heather White. It'd be ideal to communicate to all county employees, that change in regards to the designation of the non-exempt, and just clarifying.
So the
any
biggest thing
thought with
that we've
overtime.
noticed is there are actually fewer employees that are moving to exempt status than there are people that were considered exempt that are now going to be non-exempt. So previously, the county had always treated appointed positions as an exempt position, and after working with Department of Labor rules, that's not always the case. It's more of the role of your job than the position itself. So after going through that, there were several people that were maybe not receiving overtime opportunities that probably should have been. I don't know that it's gonna be an excessive amount, but, and then likewise, there's other people that maybe were receiving overtime that should not have been. So once the handbook is finished, then this will match.
An anticipation for that handbook completion.
We, Heather and I had an administrative session with the commissioners going over the changes that the vendor and ourselves have came up with, and they seem very pleased with everything. So we're turning that back over to Kristen with new focus, and then we will have a final draft. But before we send that out, we want to have a meeting with all department heads to kind of go over any and all the changes and how it might affect their departments.
Great. And will you keep council informed of that in case any of us, obviously not necessarily quote department heads, but any of us might be able to be in attendance at that meeting?
Absolutely.
Emily's been a point of discussion for us and looking at these job descriptions and controlling overtime and, but justifying pay. It'd be great.
Okay.
Thanks for all your hard work on
No
that
problem.
new handbook. All right,
I do have a question.
yes.
Anybody that might be retiring or, when does that, additional pay that they receive for, overtime, when does that go into effect that they cannot?
So from my understanding, they couldn't accrue any additional after we signed this tonight.
Okay.
Because we've never had it specific to each. So, there's additional rules that kind of complicate things. Like I immediately think a director of any kind may be exempt, but if a director or a manager has, manual labor involved, they're actually non-exempt, even if they are in a management role. There is a law that protects that.
Another
So,
definition for manual labor in the Bill of Rights.
and so, right, so
What one
then that
considers
brings
manual
up
labor is
a
not the
whole
case for
nother,
somebody
oh,
else.
I've asked very specific questions to come up with. But it's been very daunting to go through every position, and we have a flow chart.
You didn't think you were an HR expert, you might be now.
I don't know.
County's almost ISO 9000 certified.
Almost.
So any other questions for Heather regarding that, the handbook? I know she didn't come prepared tonight. That we don't even have that draft quite yet, but regarding the, because we technically need to go ahead and approve the salary ordinance this
Yeah.
evening.
I'll make a motion to approve it.
I'll second it.
All those in favor?
Aye.
Thank you for your work on that.
Yes.
Very much.
Absolutely.
Appreciate it.
That's important. I know.
We have a lot of discussion over that.
Good, right here. Very much so. All right, before we draw on any public comment, which it sounds like invisible people, we may not have any, Bob, you're not invisible, but I have a feeling you just might have any comment. We do want to quickly take a look at the committees that this council has the opportunity to serve on, board appointments. And we do have one I know that needs to be replaced, and there's been some discussion on if we should rotate or if somebody wants to come off of a board based on either scheduling conflict or personal interest and maybe have the opportunity to serve on another board. I know some of those could also depend on board terms. I know I'm currently on the public defender board, and I still have another year on that term, so I'd like to finish out that term if I could, unless somebody's begging to take that spot. But currently, right now, those that are slotted would be Judy Smith's current position on the SIRPC, which stands for Southern Indiana Regional Planning Commission. Myself is on the currently on the Public Defender Board. Gary Copeland is on the Visit Madison Board. Ray Black serves on the 911 Board. Ray also serves on the Plan Commission Board. Pam is serving on the Southeastern Solid Waste Board. Ray Denning is serving on the Community Corrections Board, and Christian is serving on the Employee Health Insurance Committee. So, I guess open for discussion. Is anybody currently serving on a board that you feel like you need to step down from?
Well, what about the EMA? I can see that.
Technically, we don't have anybody on, no longer the Animal Shelter Board is not, in the same structure.
One on the EMA.
You are on the EMA board, okay? I don't know if that's, it may or may not be required. Let's add it to the list for sure. I didn't know, is that,
I think it is, and
Okay.
I just did not have a certificate of appointment from
Okay,
last year
sure.
maybe, so we can
We may.
thank you.
include that as well.
Okay. Dwayne May serving on the EMA board, okay? And I'm not, certainly don't have memorized how much longer, as far as that term, if anybody has anything specifically, there may just be a yearly appointment, hoping to keep a council member on the board. I know it has been brought to my attention, there's currently not, a council member on the health department board. It's also not required, but, there may be an open board position. I've been asked about that as well. I don't know, that's going to be extremely, that'll be time consuming, if indeed that takes place. So if I am indeed asked to serve in that role, I will make sure and bring that to this council in case somebody else would prefer to sit in that position. Make sure that I'm able to, but for our current list, does anybody, for who you are currently serving for, the board or committee, is anybody requesting a change?
Well, I mean, I love the board I'm on, but I'd be open for a change. If anybody else wants to take a ride at the VMI.
And often does the Visit Madison, does VMI meet?
They may only meet once a month, but they have some special meetings, committee meetings, you know. just-
Evening, daytime?
Usually in the evening around 4 o'clock. Yeah, 4 o'clock, yeah. Is anybody interested in that?
And one thing to consider if Gary, if somebody else was interested, is finding someone that can fill. Judy is interested, it's my understanding, someone correct me if I'm wrong, Judy is interested in stepping down from the representation for the Regional Planning Commission. I believe they meet quarterly, but I think it's like around lunchtime, and it's not
Quarterly,
in our
March,
calendars
December sale.
for sale. So that may possibly be a limiting factor for a full-time working council member. So we do need to try and find someone who's willing to take Judy's position on that quarterly. I think she's pretty faithful at attending those meetings. But is anyone available or interested? I don't know if they meet the, first Wednesday
It
of
was
each
supposed
quarter.
to be today and it was actually canceled. So
Okay, it may not even be 4 meetings a year, possibly.
So you brought that out because you said she would show up today if we were, but this-
And,
she's stepping down though, right?
Brian, yes, and Brian Amick serves on that board for the commissioners.
Mhm.
And I know that he said that they had canceled due to weather.
Okay.
Does anybody know the length of that meeting? Is it an hour, 2 hours? I'd do it if Brian could drive me. Your thoughts?
You can buy.
Yeah, I was gonna say that's an option.
But there won't be another meeting until March or April, so we have time. Yeah.
Okay,
So I can, find out, talk to Brian.
okay. Let's take a look at that. Anybody interested then in possibly, replacing Gary on the Visit Madison board, where he might even be able to step in possibly to your shoes on your current board? I think right now, we're trying to become EMA, it looks like we all have at least one wearing a county hat on one of these boards or committees. Are you okay to stay in? that
I'm
role?
okay to stay. I'm okay to stay. I just want to be a
They haven't
pleasure.
picked you up yet or anything?
No, not that I know of. Maybe, no.
Bob, you got any insider
I got
information?
any inside information there? Okay, I'll stay.
Okay, all right, let's hold off then, I guess, I don't know if we need any type of formality this evening, let's hold off and find out, maybe we might know by next month if that's a possibility for a ride share, for quarterly meeting. Ray, thank you for your willingness.
What day is that? Or, I mean, what day is that SIRPC meeting?
Are they all always on Tuesdays? She said it was supposed to be
It was
today.
supposed to be today.
Better not.
Yeah, I would want.
It's a good lunch.
It is.
A couple other things I know that I had jotted down that I wanted to mention. Don't forget, I think everybody got a reminder email. It sounds like an Indiana State Controller is actually coming with Dan Shackle, State Commissioner, this Thursday to the courthouse, if you're available from 12:45 to 1:45. I think in the last email, they asked for an RSVP. I don't know if that's a necessity, but if anybody's available to be at the courthouse in the Commissioner's room this Thursday, to meet and greet, I think, and maybe hear reports, from these individuals for sure. I know I'd love to make a public comment and thank you, and I know I'm sure everybody at this table will echo kudos to Ben Flint and his staff. Certainly, made the paper. Thank you, Bob, my lovely picture and my stocking cap, from the jail, open house. But my gosh, to have people waiting, knowing that, you know what, 600 plus people were interested in seeing that facility that they all hope they will not, ever live in. I think they were just anxious. Everybody's really, really curious, and it's obviously, probably the biggest undertaking, financially, biggest project this county has seen in its history. So, I just think they did a great job of giving tours, sharing a little bit about the history. I think this average taxpayer understands, the necessity of that project. And, I just really give kudos to the Sheriff's Department and the commissioners as well, obviously, those that helped with that, open house. So I just want to mention that. I will mention one other thing, and it just that I know we all had a goal. Ray brought up a good point, just communication, a little bit of communication maybe is a goal this year with commissioners. And I appreciated, the recent sharing of minutes. We'll make sure if somebody doesn't get a chance to come to a commissioners meeting or vice versa for them and us, and you just either forget or don't get a chance to read minutes. I think minutes are actually going to be directly shared to both council commissioners back and forth following meetings. So that will be a blessing. And then I think in, communication, to take that one step further, I had an idea I actually had a chance to visit with Ray about it briefly. I thought it might be nice, and I've already started jotting some list of, maybe how we could divide that, but obviously I want you guys to just email me with feedback. I thought it might be great for each of us to take a lead with a department. Obviously, there's gonna be some departments that you may only have one. So for example, if Pam has the county highway garage, that being a grand budget, a big staff, that may be the only one she has the lead for, but it may be that I've got, auditor, assessor, and treasurer. Maybe it could be a couple smaller departments, specifically with big departments like sheriff and jail, the health department, county highway garage. I thought maybe blending the two in this building, even 911 and EMA. But I know sometimes we come into budgeting, we try and do our research, but we haven't always had a chance to talk to that staff. I thought if I know then in January that I'm gonna be assigned or willing to chat with these two departments throughout the year, I can make sure I know their staff. I get to meet them, I pop in and visit with them, find out if they've got a concern, if they wanna bounce an idea off one of us prior to maybe the nervousness about, putting something new in a budget or changes they need. We're sometimes blindsided, with new equipment that comes out of the air, and we didn't, see the writing on the wall that might be needed. And I think those department heads would appreciate that as well, maybe having just one of us assigned specifically to those departments.
Great idea.
Yeah, I think that's a great idea.
Okay.
And along those lines, Heather, do you think it would be possible for us to maybe and to try to, and we can take turns, one of us from the council be at least one of the commissioners' meetings a month, and we could take
We
turns
tried
doing
that
that.
in the past. It
Okay.
Didn't go through, but
Yeah.
we could.
Well, I know I want to try to do better about that this year. I've been to, I did a few, but there's 24 and
Yeah, that's
Probably hit four,
impossible
so.
probably to get to them all. No, but that's easy for us to do, to push up those dates and kind of see, even if it is just once a month. That actually would only be 1 to 2 per year for each of us then.
Yeah.
If I was at one in January and one in July.
and we could communicate, and if we can't make it, somebody could go into place. But I think it's important for at least one of those meetings for one of us to have council representation there a month.
We certainly appreciate when they're here. I know they're not this evening, but they traditionally, at least
They are.
one is here, so, absolutely, it's a great idea. In regards to kind of the lead, I don't know what we even want to call it, for each department, I guess just give that thought, and if there's one or two, if you already, work pretty close with, court services, and the prosecutor and both judges, and you think, oh, that's kind of intriguing to me, or I'd love to be able to visit with them, and you want to take that one on, just email me, and I don't mind coordinating kind of so we can just hit, I don't want to be a nuisance, obviously, and for these, department heads and staff to feel like we're, looking over them, but, I think that way they know who to call if they have a financial question or they want to chat with us about some things. So let me know if you, have a specific department you'd like to kind of be in charge of representing, and, I'll try and get us a whole schedule together here in the next month.
I think that'd be specifically helpful for the new, 911 director.
Great point.
Whoever's hired, because, that's a tricky budget anyway,
Yes.
and might be able to, especially the first year, kind of walk them through it.
Absolutely. And I suppose that's a great example, because obviously we do have representation on the 911 board,
Yeah,
but maybe that's an easy one
right.
for the person that already sits on that,
I'll be happy, once
board
that's
to, yeah.
determined, I'll be happy to do that.
We obviously have more departments than we have people seated at this table, so we certainly have some smaller departments that some of us may need to take multiple departments. To whoever has, the sheriff's department and jail, we won't give you any extras. I'd say that's probably big enough. That may be, a big enough, I don't know, Chris, you did a ride along. It's pretty cool. You should take that. Chris in his second life's gonna come back and be
Gary, you did one.
a SWAT team
I'm
officer.
getting ready to do one.
Very cool. Awesome.
Well,
Okay, we'll give that some thought.
maybe I can go along with Bobby Phillips and lose weight by filling in potholes this year.
There you go.
That'd be my new weight loss regime.
All right, any public comments?
Are we gonna nominate these now, or is it just that we're all staying?
Let's
Hold
save
on.
them for next month.
Okay.
And I'll revise so that we can approve it all in one.
Perfect, yeah, instead of individually, and we'll make sure and get Dwayne added under the EMA.
I will say, if we know by then that there's gonna be a seat at the health department, and that's very time consuming, my suggestion would be, because you're wearing a lot of hats, maybe somebody else take the public defender, unless you want to do both.
Yeah, no, and luckily, the board does only meet, well, I've heard quarterly, I also heard sometimes monthly, obviously, they were a little more active during COVID. But it's not as a super involved board, not necessarily, Sue Stack, who is the current, replaced John Hustler, obviously, she's extremely involved in this, been active, but I don't think the board has had to do a ton in the past, but I'm anxious to hear more. And again, it's not a current opening on that board, but I've told it may be forthcoming, so I'm gonna ask about that, for sure, good point. All right, well, we would just entertain a motion to
I'll make a
dismiss.
motion to adjourn.
Okay, adjourn, Ray Black, in a second.
I'll second it.
Carrie. And thank you to Ray Black for your leadership this past year. Much appreciated. Thank you. All right. All those in favor? I think we've got an item, everybody. We will see everybody next month in February.